Welcome to This Explainer. Today, we're taking on a topic that touches the lives of millions of men and their families all over the world. We are going to completely demystify prostate cancer. By breaking down complex medical guidelines and the latest international clinical data into a clear, structured journey, This Explainer is really designed to empower you with direct, evidence-based knowledge. We're going to walk through everything from the basic biology of the disease all the way to the absolute cutting edge of modern survivorship. So here is our roadmap for today. 1. The baseline. 2. The red flags. 3. The detective work. 4. The strategy. 5. The reality. And 6. The future. Let's get right into it.
Section 1. The baseline.
Now, prostate cancer is one of the most common cancers affecting men worldwide. But the crucial point I want you to take away right out of the gate is a massive message of hope. It's highly, highly treatable. Thanks to incredible leaps in early detection, risk-based screening, modern imaging, and precision medicine, survival rates have absolutely skyrocketed. You know, we're no longer in the dark ages of cancer treatment. We have highly effective, incredibly targeted tools at our disposal today. Okay, so to understand the cancer, we first kind of need to understand the organ itself, right? The prostate gland is a vital part of the male reproductive system, tucked away deep in the pelvis, near the bladder, the urethra, and the pelvic floor muscles. It's actually divided into distinct areas, the peripheral, transition, and central zones. And just for a little context here, the peripheral zone is particularly important because, well, that's where the vast majority of prostate cancers actually start. In a totally healthy state, its everyday job is simply to produce seminal fluid. But think about the stark contrast between healthy, functioning cells and cancerous ones. Normal prostate epithelial cells, they obey the rules. They have strict cell cycle regulation and built-in DNA repair mechanisms. But on the flip side, driven by DNA mutations and things called oncogenes, which essentially act like a stuck gas pedal, these cells lose their off switch completely. They just grow uncontrollably. And it's exactly this loss of regulation that creates a malignant tumor, one that can locally invade surrounding tissues or even spread to other parts of the body, which is what we call metastasis. Moving right along to Section 2, the red flags. So, what actually causes this? Well, while a single exact cause is still a bit of a puzzle to the medical community, we have identified several major risk factors. Simply getting older is a huge one, but genetics play a massive role too. Having a family history of the disease or inheriting specific gene mutations like BRCA1 and BRCA2 significantly elevates your risk. On top of that, men of African ancestry have a notably higher risk of developing it. And transitioning over to lifestyle, there are also potential links with diet, like eating a lot of saturated fats, and obesity, which is often tied to a much more aggressive form of the disease. And this brings us to a, frankly, terrifying but absolutely vital truth about this disease: 0 symptoms. In its early, most curable stages, prostate cancer often operates in total and complete silence. I mean, there's no pain, no frequent urination, no warning bells at all. Now sure, later stages might bring symptoms like a weak urine stream, pelvic pain, or blood in the urine, but initially, literally nothing, which is exactly why our next section is so incredibly critical. Section 3, the detective work. Because of that silent early stage, how do we actually find it? Well, the modern diagnostic pathway follows specific steps, all based on shared decision-making between a patient and their doctor. Step 1 usually starts with a simple PSA, or prostate-specific antigen blood test, sometimes paired with a physical exam. If those raise a red flag, we move to Step 2, a multiparametric MRI. This is an advanced scan that uses a scoring system called PRADS to highlight suspicious areas. It functions almost like a heat map for the doctors. Finally, Step 3. If that MRI shows something concerning, the doctor performs a targeted biopsy. Make no mistake, a biopsy is the only way to definitively confirm a cancer diagnosis before any treatment actually begins. If that biopsy does unfortunately find cancer, the detective work continues right into the pathology lab. Pathologists examine the tissue under a microscope and assign what's known as a Gleason Score. You can almost think of this score as a measure of chaos. It evaluates just how mutant and aggressive the tumor cells look compared to completely healthy tissue. It's really the foundational metric for figuring out exactly what kind of cancer we're dealing with. To make those scores actually actionable for doctors, they're organized into grade groups, ranging from 1 to 5. So Group 1 indicates a low-risk, slow-growing tumor, while all the way up at Group 5, that indicates a very high-risk, highly aggressive cancer. By taking this grade group and combining it with the patient's PSA levels and their TNM staging, which is just a measure of the tumor's size and whether it's spread, doctors can accurately pin down the patient's exact risk level. Section 4, the strategy. Once we have that exact risk profile, the game plan totally shifts. For instance, with low-risk disease, the best strategy is often active surveillance. That means strictly monitoring the cancer to avoid the side effects of treatment for as long as safely possible. However, if the cancer is localized but much more aggressive, definitive treatments are going to be required. This could mean robotic-assisted surgery to physically remove the prostate, or radiation therapy, using either external beams or internal seeds to completely destroy those cancer cells in place. But what if the cancer has already spread? For advanced or metastatic disease, the strategy shifts entirely to some seriously cutting-edge systemic treatments. It usually starts with hormone therapy or androgen deprivation to basically starve the cancer of the testosterone it's using as fuel to grow. And from there, medical science has developed some truly awe-inspiring tools. We're talking chemotherapies like docetaxel, targeted precision medicines like PARP inhibitors that go after specific genetic mutations, and brilliant innovations like lutetium-177 PSMA radioligand therapy. That last one literally acts like a microscopic smart bomb, actively seeking out and targeting cancer cells anywhere in the body. It is just remarkable science. Section 5, the reality. Let's ground all this science in a real-world scenario. Follow this timeline with me for a patient we'll call Case 4, who was diagnosed on day 1 with advanced metastatic disease. You can see this incredibly clear, structured progression of multidisciplinary care over a few years. By month 2, hormone therapy kicks in to halt the growth. By year 2, as the cancer tries to adapt, the medical team pivots to chemotherapy and those advanced PSMA-targeted therapies we just talked about. And stretching into year 3, the focus integrates strong palliative care, managing bone metastases, and making absolutely sure his pain relief and overall quality of life are prioritized. It really goes to show that even in advanced stages, there's a robust, highly active playbook to fight the disease and support the patient. And finally, Section 6, the future. We really need to bust this myth that treatment side effects, like urinary incontinence or erectile dysfunction, are just some permanent, unmanageable life sentence. Now, they are challenges, absolutely, but modern rehabilitation is highly effective. Today's survivorship programs use targeted physiotherapy, like Kegel exercises for pelvic floor training, right alongside progressive resistance training and nutritional counseling to help restore physical function. And just as importantly, structured psychological support is a massive priority to protect the patient's mental health and overall quality of life moving forward. Now, what about prevention? I want to be super clear here. Currently, there's no guaranteed magic bullet way to prevent prostate cancer from occurring. But adhering to a healthy lifestyle, keeping a balanced diet, engaging in regular exercise, managing your weight, that puts you in the absolute best possible position by reducing your overall health risks. And when you couple that proactive lifestyle with risk-based screening, it means that if it does happen, you catch it early when it's most treatable. I want to leave you with this final thought to chew on. Given the sheer, incredible evolution of targeted therapies, robotic surgeries, and molecular biology that we've just walked through together, the landscape has entirely changed. The future of prostate cancer survivorship has literally never looked more hopeful. So the question is, are we entering an era where, thanks to early detection and incredibly precise science, the vast majority of men simply live out their natural, full lives with prostate cancer rather than dying from it? It is a fascinating, hopeful question to end on. Thank you so much for joining me for this explainer, and keep learning.